Welcome back to Cancer Buzz. I'm your host, Summer Johnson. On this mini episode, we examine the business case for hiring oncology social workers. Krista Nelson is an oncology social worker and the program manager of quality and research at the Providence Cancer Institute in Portland, Oregon, and she's the ACCC president.
One of the most important things that we do as oncology social work is we support patients, their families, their support systems, as well as the providers. And that's helping oncology centers and practices meet the quadruple aim. What we really wanted to do was to be able to provide a business case. When we meet with C-suite leaders and providers around the country, they say they would love to have more oncology social workers or supportive care staff, but what they're not sure is how to pay for it and how many they need. So within my presidency and my theme, I was able to bring together some of the world's leading experts in psycho-oncology, really specifically gathered a few key leaders. So we connected with Brad Zebrak and Barbara Jones for research, Vicki Kennedy, Jennifer Byers, and Courtney Bitts for their leadership in the field, and Shirley Otis Green for her leadership in palliative care. And we got together and spent many, many months focusing in on what value oncology social work played and how it makes a difference in the business case for practices.
Tell us about the new tool from ACCC called Making the Business Case for Hiring an Oncology Social Worker.
Research tells us that at minimum 30% of patients need psychosocial intervention during their cancer journey. And actually, even through the trajectory of their treatment, more and more people will need multiple touches by supportive care. Failure to attend to these concerns, that impacts patients' outcomes. It costs the system more. They may use the system inappropriately, not have access. It increases moral distress for the patients and families. And despite knowing this, many institutions are saying, we don't have enough supportive care. We're trying to figure out a way to provide supportive care for our patients with cancer. We gathered this expert panel of people together to create the business case for hiring oncology social work. We wanted one place where people could go to get evidence-based literature, research, paying attention to social determinants of health, and how if we attend to those, it makes a difference for not only high quality, high impact psycho-oncology care, but also will impact the bottom line of cancer care.
What about the resource do you think is really unique and particularly useful for community cancer centers?
One aspect of this project that I'm most excited about actually is that we are launching ACCC in partnership with AOSW and APOS is a benchmarking survey. Now, we know that we get a lot of surveys and that they're hard to complete, but the other thing that we know is that all of the leaders within ACCC have asked for this. I think the first question when you think, I want to provide good psycho-oncology care for my patients and their families with cancer, the next question is, well, how many social workers in that? And the truth is, this answer does not live within research, and it's because it's a hard question to answer. And so this team, we really tackled how could we get some just basic benchmarking data to be able to determine where we stand and thus be able to give us some research, a place to jump off our future research. We know the survey will take a little time, but we're really interested in knowing what does the landscape look like right now? How many oncology social workers are out there per new oncology visits? How many oncology social workers are there out there per provider, meaning per MD and APP? These questions will really, once answered, will really give us a sense of across the country where psycho-oncology care stands for our patients with cancer.
What about the move to value-based care and alternative payment models? Is adequate reimbursement of comprehensive cancer care services possible?
One concern I have as an oncology social worker is worrying about adequate reimbursement with comprehensive cancer services with the move to value-based care and alternative payment models. We know that supportive care are some of the services that are likely to be at risk of being cut when payment isn't adequate. So one of the things we're really advocating for is that reimbursement be adequate to be able to provide supportive care for all of our patients, even other disciplines other than social work. That includes dietitians and rehab and genetic counseling.
Krista, you've been in oncology social work for 24 years. How close are we to fully utilizing these comprehensive care services?
I think the oncology community is getting closer. I really see a difference. And I don't know if it's that my view is expanded through all of ACCC, but I see amazing people doing amazing work across the country. I do think some national standards that require psychosocial care, and in the last couple of years, honestly, the attention being paid to social determinants of health and bringing the social care into healthcare. We know that attending to patients' psychosocial needs make a difference in patients' care, and it also makes a difference in the cost of care. And the time is right for social work to be at the table, and just excited for this opportunity to get some good data about how many oncology social workers there are out there doing this good work, and then looking forward to new research that can be done in this field. Then I think the learnings can expand from beyond oncology social work to all other disciplines that would be bundled into a value-based model.
Cancer Buzz has big plans for the new year, so keep an eye or an ear on this channel for regular, fresh perspectives and the latest trends in cancer care. You'll want to make sure to hit the follow button on Spotify, Apple, or wherever you like to get your podcasts. That way, you'll be notified every time a new show is released. Next week on Cancer Buzz, TIL cell therapy and why immunotherapy will be reaching every person in oncology care very soon. Until then, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.